Covering coronavirus now, medical experts are fearing state hospitals could soon run out of resources. This as Oklahoma City continues to see a rise in hospitalizations, pushing them into a higher tier in the state's surge plan. 2 Works for You's Brady Halbleib joins us now live with what some of our local hospitals are seeing and why experts say the general public is their last line of defense. Brady.
That's right. OU Chief Medical Officer Dr. Cameron Mantor described the current hospital situation as a broken water faucet. Medical staff are seeing an influx in patients with no end in sight, and St. Francis Health System echoed that message last week, saying the current hospitalization rate is not sustainable, underscoring the importance of wearing a mask.
Hospitals cannot stop a pandemic. People, citizens, Oklahomans have to stop the pandemic.
OU Chief Medical Officer Dr. Cameron Mantor says the general public is the final safeguard against hospitals reaching their breaking point. He says that all comes down to wearing a mask.
We have to impact that in the community, or we're spinning our wheels. We will run out of resources in the hospitals.
Oklahoma City hospitals are on track to enter Tier 3 of the state's hospital surge plan. That means nearly 20% of patients hospitalized are there with COVID-19.
Unless something happens with the disease itself in the community, that we will reach a point where we are overwhelmed.
According to the State Department of Health, Tulsa County remains in Tier 1, meaning that less than 15% of patients are hospitalized with COVID-19. Still, St. Francis Health System said last week the current hospitalization rate is unsustainable. Meanwhile, Hillcrest Medical Center says they too have seen an increase in patients being treated for COVID-19. They are now between 90 to 95% capacity with both COVID and non-COVID patients.
We either won't have beds, or we won't have doctors, or we won't have nurses to take care of patients.
Tulsa County's surge hospital was OSU Medical Center, but the term of the contract designating them as a surge facility ended September 21st. That would have allowed the hospital to receive contract nurses to help support the facility. Now they'll have to staff their own. As of November 1st, the White House Coronavirus Task Force lists Oklahoma among middle country states heavily impacted by the spread of the virus. Tulsa County remains in the red zone and cases continue to rise across the state, emphasizing the importance of COVID-19 safety protocols.
It's not hard to do. We've just got to figure out how to message to the people that this is a paramount importance. They have to be part of the solution.
Dr. Mantor also mentioned unmasked voters going to the polls yesterday could result in a spike in cases. However, we won't be able to see that reflected in our numbers for another few weeks. Brady Halbleib, 2 Works for You.